I'm assuming it is very important for diabetics to get regular screenings.
Absolutely,
How
absolutely.
regular?
To be very frank, in a diabetic individual, the best thing is to know the numbers.
Mm-hmm.
If their fasting sugar is remaining less than 110
Mm.
and their PPBS, that is postprandial sugar level, ideally
Mm.
should remain around 140 to 160.
Mm.
And their HbA1c, which is a average of 3 months sugar, ideally
That
it should
is
be
the amount of sugar in the hemoglobin, right?
in the hemoglobin, that is
Mhm.
HbA1c, it should be less than 6.5.
Okay.
This is called a completely controlled sugar.
Hmm.
Ideally, if the patient is taking medicine, then they should get themselves checked for sugar level at least 3 months,
Okay.
because that is where you will
So
be
you
able to
keep
see
your A1C
in check.
steady. Hmm.
Absolutely, because ultimately another important point what I wanted to hear, like emphasize is that when you find out that you are having diabetes, then you need to treat it like a T20, like
Okay.
the play overs,
Hmm.
that power play, first 5 overs. Once you know that you have diabetes, you have to strike very hard. You
And
have to
very
keep
quick.
it very, very under
Hmm.
control. So intensive sugar control is required. If you maintain it for 5 years,
Hmm.
you can delay the complication by more than 20 years.
That is fascinating. I've never heard of this
So
before.
this is something,
Mm-hmm.
by and large, what happens is that in India, in most of the part of India, you get or rather diagnose diabetes after the maybe 3 4 years.
Hmm.
You are having diabetes, you do not know because you have never checked yourself. So regular health checkup is very important. And it is not that those who are having family history,
Hmm.
those who are having at high stress related a job stress or any stressful condition, and those who are having another comorbidity like high blood pressure,
Hmm.
obesity, smoking tobacco, or
Drinking also,
any
right?
any any sort of bad habits,
Hmm.
and you are having some sort of weight related issues or obesity, all these things are considered as a comorbidity. You must check yourself for sugar level and your cholesterol.